Menopause is defined is when you're you haven't had a period for 12 months, and then we say you're in menopause. The average age in the U.S. is 51.3, and natural menopause occurs when your ovaries just retire. They've stopped, they run out of eggs. And induced menopause happens when there's something else that occurs to make the ovaries stop working, whether they're removed surgically or you have a medication, chemotherapy, or something that makes the ovaries stop working. So the physiology of menopause, there's a lot of changes that happen in the body when all of a sudden you don't have estrogen anymore. Your body's been used to having the presence of estrogen since the time of menarche, is when you undergo a lot of changes at the time of menarche. And one of the big changes I explain to people is that your body undergoes a fair amount of inflammation kind of throughout your body when you lose your estrogen levels with the loss of ovarian hormones. And there's definitely an increased risk of heart disease and changes in your vascular system when you don't have your estrogen. Women will notice changes in their joints and their muscles. They start to get achy kind of everywhere, and that's that kind of inflammatory change. I'll see people who've already maybe been to the rheumatologist or the orthopedic surgeon because of a lot of achiness, and it may just be menopause. There's a lot of changes in the genitourinary system, which is very estrogen dependent. A lot of changes in the vaginal system, a lot of changes in the bladder system. In my office, I'll see people in their early 50s, their urgency and frequency. And the first thing I say is, what's happened to your cycles? And we all notice a lot of changes in the skin, a lot of changes in the hair, thinking changes, memory loss, brain fog, and a lot of psychosocial changes.